Hi, Dr. Lou here. So this next group of exercises are very important for a number of different reasons why people come to my office. It could be an acute injury, an automobile accident, some type of neck injury that we're eventually rehabbing them from. It could be a chronic pain syndrome, a chronic neck pain, upper back pain, headache scenario, the tech neck thing that we hear a lot about today, stuff that slowly broke down over time. It could be a shoulder problem, a rotator cuff injury, an impingement syndrome, rehabbing a frozen shoulder. I use these exercises a lot in my office for various things. And so the important thing to remember is they build stability and also help repair posture. Because if you've been to my office, you've probably seen me demonstrate the bowling ball. So this bowling ball weighs 14 pounds, and the literature will tell you that the average human head weighs 10 to 15 pounds. So people don't really understand how heavy that is until I hand them the bowling ball. So for instance, if I stand in good posture and I have the bowling ball like in good posture, the weight of the ball is supported by my arms, just like the weight of my head is supported by my spine. But as I start to drift forward, whether it was from an injury or over time, now all of a sudden it changes everything, because as this bowling ball goes forward, if you could see, these muscles are really firing now to keep this ball from falling down. In other words, as my head goes forward, these muscles have to fire extra hard to keep my head from flopping forward. So we're going to go through these exercises and show you how you can rebuild posture, rehab a shoulder, get rid of those chronic knots that are always in your upper back. I call this next exercise the chin tuck, and we're going to do it lying on our backs. I'll show you that in a second. What this exercise does is it helps to reduce and help to retrain that head forward posture that everybody's getting. When the head starts to go forward, we want to do some exercises to help bring our posture back. So this exercise actually does two things. It helps to stretch the little muscles at the base of the skull, which many times can cause those tension headaches, and also helps to strengthen the neck muscles to help hold the weight of our head up better all day long. So now I'm lying on my back comfortably, my knees are bent, my low back is de-stressed, very comfortable, hands resting on my abdomen, and I'm going to look straight up at the ceiling now. And I'm going to close my mouth but not clench, and just gently tuck my chin back into my neck like this. Now I'm not using my shoulders, I'm not using anything else. It's a chin tuck, just this simple. Once my chin's tucked, I'm going to push my head back against the mattress, my entire head, as if I was pushing it back this way, and I'm going to hold it for 3 to 5 seconds. Here we go. Now, how hard am I pushing? If I ask you to push 100%, I'm only asking for 20 to 30%. Enough where you could feel some activity. You're feeling like you're using your muscles, but it's not hurting. It's not causing any pain. You're going to hold it for 3 to 5 seconds, and you're going to repeat that 3 times. Do it every night before you go to bed, or do it in the morning when you get up to help build better posture. One last time. This next exercise is called the W. It's to help rebuild poor posture. In other words, as a society, we're getting more into this, and we want to try to reverse that. The chiropractic adjustments that you have been getting will allow your spine to come back into this position as best it can. But now we want to reinforce some strengthening exercises for these muscles right through here. I call them scapular stability exercises. So here we go. You start with your feet about shoulder width apart, maybe your knees bent a little bit, very comfortable stance. Notice my head is up straight and my eyes are on the horizon line. I'm going to bring my elbows up to about shoulder height. Doesn't have to be higher, but certainly if it hurts to raise your arms up, bring them up as far as you comfortably can. And then you're going to bring your elbows down toward your side, but most importantly, you're going to try to put your elbows in your back pockets. That's the key. And you're going to, almost like you're pulling a rope down and putting your elbows in your back pockets. I'm going to turn around and show you what that does. So watch between my shoulder blades. As I come down, my scapulas, if you look at my hands, are coming down and in. I bring my arms up, and then I'm pulling that rope down, imaginary rope down and in, bringing my elbows to my back pockets. We're going to do 10 reps, and we're going to repeat this 3 times. Now, you don't have to do these all at once. We're all busy. Maybe you're standing there waiting for your coffee to heat up in a microwave. You can do 10 reps. Maybe you're waiting for something to come out of the washing machine before you put it in the dryer. You can do 10 reps. You're at the office and you went and take a potty break, or you're going to get some water, and you can do 10 reps. So you can do these periodically throughout the day and get it done at that time. Now, another way you can do this, if you have a wall, is you kind of lean up against the wall. I'm going to put my head against the wall, my shoulder blades against the wall. Look at my feet. They're about shoulder width apart, but they're about 6 inches away from the wall. My knees are bent. So I'm very comfortable. My butt's against the wall. It's almost like I'm leaning against the wall. So again, shoulder height. I'm going to bring my elbows down towards my back pockets. Imagining I'm pulling a rope down and in. Working those shoulder blades, 10 repetitions, and repeat 3 times. A great exercise to help rebuild your posture. So for this first exercise, you need to have some little hand weights at home. I get them at Walmart. That's probably the most inexpensive place. 1 pound, 2 pounds, 3 pounds. You'll probably want to start out with 1 pound. You'll be surprised how weak this muscle is. We're going to strengthen the supraspinatus. It's an important muscle for the rotator cuff. So if you don't have anything to start with, you can use water bottles for now, but eventually get yourself a couple of maybe a 1 pound and a pair of 1 pound and a pair of 2 pound weights so that you can do this exercise effectively. So we're going to stand in good posture. Now, if I was to take an arc from straight out in front of me to all the way out beside me, that's 90 degrees. We're going to go to approximately 45. Halfway is where we're going to start this exercise. We're also going to do it thumbs up, not this way, not this way. Thumbs up. So we start at our side and we come up to shoulder height and down. Up to shoulder height and down. I like to use the rhythm 1, 2, 3, down, 2, 3, up, 2, 3, down, 2, 3. You'll do a set of 10 and do 3 repetitions of it. Over time, when you get stronger, go to one set of 15 reps, 3 repetitions, or 3 sets, I'm sorry. And then maybe another few weeks later, try to get to 3 sets of 20. You do these every other day to give your arms a day off. And of course, if they make you worse, stop doing them until we talk. So for these next 3 exercises, you need something like this. We sell these at the office. This little end goes through the door, and we can do this with a doorway at home. This is a very low-tech, very inexpensive way to get these exercises done. If you have a set of bands or straps at home, bring them to the office and I can see if they'll work. And as I said, we use these particular ones at the office as well. We'll show you how to set it up into the door and then we'll run through the exercises. So here's how you start these. You take this little end, or if you have your own band, if it has to have some type of knot or something in it, and you stand next to the door you're going to use, and you put your elbow at 90 degrees. This is the height setting, okay? So it's right there. I'm going to open the door, slide that through, shut the door, and now it's secure. So I can use this as a resistance band. So the first set of exercises, I'm going to strengthen the muscles between my shoulder blades called the rhomboids. So I'm going to stand back in good posture, head up straight, so that I have enough tension. The farther back you go, obviously you can create more tension, so that's how you adjust the resistance. You want to be able to go through full range of motion and feel like you're getting good resistance without hurting, right? So I got pretty good resistance here, good posture, and notice I'm bringing my elbow straight back and I'm squeezing my shoulder blades together. I'm almost trying to bring my shoulder blades together on the backstroke. Hold for a second and then slowly let it go forward. So we'll do that cadence. Back, 2, 3, hold, up, 2, 3. Back, 2, 3, hold, up, 2, 3. We'll start with a set of 10 repetitions, and I'll show you how you can go through this in a circuit, and we'll repeat the circuit 3 times. So let's say I'm at number 8, number 9, number 10. Now I'm going to let this strap down, and I'm going to do something called open the door with my left hand. Again, I can move in and out to adjust resistance, but I want to be able to do this all the way out. Whatever I can do without resistance, I want to be able to do with resistance without pain. So I'm going to keep my elbow at my side. I'm not doing this. It's this. So open, 2, 3, close, 2, 3. Open, 2, 3, close, 2, 3. Now let's say I'm on number 7. Close, 2, 3, 8, close, 2, 3, 9, close, 2, 3, and 10. We're going to start out with that set of 10. Now I'm going to take my right hand and do a closed door with it. Move a little away to get the resistance. Close, 2, 3, open, 2, 3, close, 2, 3. And remember, you can adjust the resistance by moving a little farther out, moving a little farther in, whenever you can get a good feel like you're working the muscle, but not to the point where it hurts. Over time, as you get stronger, you can increase the resistance, and of course, we're going to increase those repetitions, eventually going to 3 sets of 15 and 3 sets of 20. And as a reminder, every other day on this, not every day. So now to do the other side, I'll have to turn my back to you, but I'm going to turn around so I can work the left arm and then the right arm from the opposite way. So I turn around, get my resistance. Now it'll be close the door with my left arm. Close, 2, 3, open, 2, 3. All right, I go through my 10 repetitions of closing the door with the right arm. Then I step in a little bit, take it with my right arm. And now I'm going to open the door with my right arm. Notice, keep my elbow tucked. There's a lot of times when patients show me, they start doing this. I want to let you know, you want to pivot on the elbow, keep the elbow at your side. And I would finish my 10 repetitions of opening the door. Okay? So that's the 4 exercises. And then I am going to now show you how to go through all 4 of them. We'll do 5 reps each just for demonstration purposes. So here's how fast you can get this done. Now we're doing 5 repetitions for demonstration purposes. Remember, thumbs up, 45-degree arc. Here we go. Up, 2, 3, down, 2, 3. Down, 2, 3. Down, 2, 3. Down, 2, 3. Last one. Down, 2, 3. I'm going to set these down and come over to my tubing. We're going to start out with the rhomboid rows. 1 foot forward, 1 foot back if you look at my feet real quick here. Because if you have your feet together and somehow this would snap, you can fall over. But if you're this way and it would snap, you won't fall over. So get in this stance, and here we go. Back, 2, 3, forward, 2, 3. I'm going to do this one 5 times. Forward, 2, 3. Rep number 3, forward, 2, 3. Rep number 4, forward, 2, 3. Rep number 5, forward, 2, 3. Set this one down. Open the door with my left hand and close. Open and close. I see a lot of patients, they want to watch what they're doing, and that brings their head forward. Look straight ahead at the horizon. Stand with good posture. This helps reinforce the whole posture thing that I talk about constantly. And we'll say that's number 5. Slide over. Get the right arm on the closed door. And now I'm letting this arm rest while I'm working the right arm. And Last one. Now I'm going to turn around and work the left arm again with the door closed. And then slide in and do the open door with the right arm. So you see I've completed all 4 of these exercises in a circuit. And then I would just run through that again 2 more times for my 3 sets of 10. Do that for maybe 1 or 2 or 3 weeks until it feels routine. You're doing this every other day again. Then go to 3 sets of 15 for 1 or 2 or 3 weeks. And then finally end up with 3 sets of 20. When you get to 3 sets of 20, here's the good news. You can drop down to twice a week now with this and maintain it. Because if you stop over time, you're going to break down again. But if you'll just do these a couple days a week and do those little stretches we started earlier every day, you're going to go a long way to keeping well and preventing regression.